Nothing like super specialized.
That is.
So I just wanted to see some of that stuff.
Oh, wow.
All right. Not quite yet. Yep, I guess we could. Thank you very much. I appreciate it. It is 12:30-ish. I'd like to call the meeting to order. The Board of Health date is February 8th, 2023. I'm looking for a motion to approve the January 2023 minutes. Do I see a motion?
So moved.
Stephanie's first. Chuck second. Those in favor?
Hey.
Aye, okay. Passes unanimously. No amendments. Moving on. Lindsay, would you like to give your presentation?
Sure. Lindsay Bond, epidemiologist for the city of Nashua. Just a quick situational update on COVID-19 and the newest variant that's being identified by the CDC as a variant of concern. So for New Hampshire, we've had a total of 373,867 cases since the beginning of the pandemic. There have been 95 new cases reported. I also want to mention too that this data was last updated on the 2nd, so it's very old. Hasn't been updated since on DHHS's website. For hospitalizations, this is updated. So as of yesterday, patients in the hospital positive for COVID-19, there was 86, and 32 of those were being treated with antiviral medications. We've had a cumulative death count of 2,949 deaths in the state of New Hampshire. And for Nashua statistics, this was last updated on the 2nd as well. There was a total of 26,845 cumulative cases since the beginning of the pandemic, and 7 new cases reported as of the 2nd. As mentioned previously in many of these meetings, this is an undercount of what we're seeing realistically, because this is only tests that are being submitted to the state laboratory that are being counted. For patients in the hospital in Nashua, there are currently 14 patients that are positive for COVID-19, and 7 of those are being treated with antivirals. I'll quickly go over the CDC community level, which is based on the number of patients admitted to the hospital within the past 7 days and the number of patients using inpatient beds within the last 7 days. As of right now, our community level is low for Hillsborough County. Recommendations from the CDC is to stay up to date on vaccinations, maintain ventilation improvements within buildings, avoid contact with people who have suspected confirmed COVID-19, and they also provide resources if you've been exposed to someone who tested positive, and then you can also wear a mask if you choose to do so. Any questions on that update?
Stephanie, Chuck, any questions?
No, thank you.
Great, thank you.
Okay.
Nice and
Thank you. I
succinct.
like the
So I will go over the new variant of concern. It's called CH1.1. It's also being called Orthrus. So there is this new naming coming about for new variants because it's somewhat confusing using letters and numbers to name these variants. So they're naming them after mythological creatures. So Orthrus is a 2-headed dog in the Hercules story, so they're going with that one. As of right now, it accounts for 1.6% of tests being genomically sequenced, but it is predicted that this is going to increase. It's considered highly transmissible, and it has a mutation that can increase its ability to evade vaccine protection. So definitely something to keep an eye on. Right now, the majority of variants being detected is still the XBB 1.5 or the Kraken. Continues to be predominant across the U.S. with 66% being genomically sequenced in the U.S. I also provided a picture from the CDC that has a breakdown of variants over time since looks like the beginning of November to the most recent of February 4th. Any questions?
Thank you.
Okay, thank you.
I have a question.
Oh, I'm sorry.
All right, thank you. I just have, my question is have to do with the vaccination update. I know there's 5 now. Is there a possibility there'll be a 6th? Because I'm no longer in the study anymore, so I'm not sure if it will be a 6th to cover these variants.
Are you saying like booster vaccination? So it's hard to say. I could get back to you on that too. I know there is some talk about having a booster every year following, so I'm not totally sure.
So, if there's someone else that would like to answer?
I was just gonna reiterate some of that, thank you, Stephanie, that there was a meeting at the end of January where they were discussing the new variant and how to proceed for yearly, and it's probably going to be a yearly booster, similar to what we do with flu, based upon what variant is out there. Was that similar to what you
Yes,
guys
and
said?
and if I could just add very slightly to that, studies would seem to indicate that the newest bivalent vaccine has only limited advantages over the original vaccine and against the original variant. So while it was originally thought that if there was slow mutation, they would keep trying to update the vaccine to meet that need, that doesn't seem to be working in quite that same way. So would not expect them to come out with a new bivalent, in 6 months from now in order to try to keep one step ahead, but rather what they said. So,
Thank you.
And can I just add?
Sure.
And I would just add that the idea of promoting booster right now is so that, folks, if they do end up with COVID again, vaccines were made to reduce the severity of disease, shorten the length of time that people were out, reduce hospitalization. And so with each of these variants, although there may not be a new booster to match up with the variants, we are encouraging people to go ahead and get the booster to reduce the severity of any illness that they may have an effect of as a result of COVID. So we're still promoting and we'll be campaigning for people to go ahead and get that booster, finish their series, so that, again, we reduce the severity of illness.
Any further discussion?
No, thank you.
Very good. Okay. Moving on, Bobby. Director's
Yes.
report, please.
Thank you. So I'll just read our mission really quickly. It's to promote, protect, and preserve the health and the well-being of the greater Nashua region through leadership and community collaboration. And our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. We subscribe to the following values of integrity, leadership, adaptability, and respect. And from the work that is done collaboratively across and collectively across our departments, it's, to meet that vision and that mission. Just quickly, just operationally, we've changed our joint calls from weekly or bi-weekly to monthly now with our medical partners. And this past meeting that we held with them was to really review the impact of the extreme cold that resulted in several incidences at our two hospitals, our community health centers, and at the mental health center. They were quickly resolved. Some resulted in some temporary closures, but there was minimal client impact or patient impact. And I'm hoping that Heidi will also give an update on what they saw with the environmental health over the winter, the extreme cold. What it does remind us is we put a lot of attention on making sure that we looked at the human impact. And then our messaging going forward will make sure that we remind folks of the structural things that they have to put in place as well, because I don't think many of us were anticipating the damage that was done through the frozen pipes and then the water damage that was done in some places. I do continually meet with the executive leaders of those particular organizations, and we'll meet Friday and we'll learn a little bit more about the outcome of some of the things that happened. One of the other things I wanted to just bring to the attention of our board is that myself, the welfare officer and environmental health officer and deputy had an opportunity to participate in a couple of meetings this month with the state, and that the community health chief public health nurse and myself also met with DHHS around information with vaccines. And so there's a hearing that'll be coming up next week that will go and testify regarding funding that that Senator Rosenwald has been able to identify for us to prevent individuals from not being able to get vaccinated because of the restrictions related to 317 funding mandates around Medicare and Medicaid holders. Legislative update, we've just begun following legislation. I did attach the PowerPoint presentation that we used at the mayor's legislative breakfast last week, and then we will closely follow legislation as it comes up. We do have at the New Hampshire Public Health Association and New Futures, right, send out information on legislation that they're following, either supporting or opposed to, and we will continue to follow and track that as well, and then make ourselves available for some of the sessions that they have if they need us to testify as well. We did have our 5th annual Mayor's Opioid Task Force Legislative Breakfast, and I did send a link for you to view that session. Lots of good information came back from that addressed a number of the issues that we've been dealing with unhoused seniors, and they're being referred to either motels, hotels, or to shelters. And so that's been an ongoing conversation that we've been having. But the presentation, if you haven't had a chance to take a look at it, please do, because there's a lot of solutions that will come forth from that as well. Quick financial update. Last time we met, the additional amendment to our Public Health Network Services, emergency preparedness, and our health disparities grants were presented to the Board of Aldermen. That passed without any issues and was sent forth for governors and council, and hopefully will be heard this week so that we'll get that funding and be able to move forward with that. There has been also some, there'll be some opportunities for future funding to come down to Nashua as well. And then just some highlights of some of the work that's been done across community services in conjunction with some of our other departments. Our behavioral health team continues to do work around substance use disorder, health, the mental health first aid training, at least once in January, and had 4 screenings of the biology of stress and the science of hope, which allows for us to help our partners explore root causes for substance use and behavioral health issues as we continue to build on some of the interventions and programs to address that. You heard from our epidemiologist already, but Lindsay continues to lead our community health assessment planning activities. We'll be co-facilitating our infection prevention control meeting with our partners at the hospitals and nursing homes on Friday, and we'll be presenting at our Public Health Advisory Council meeting tomorrow on what we're looking to move forward with our community health assessment with our community partners. Our health disparities community health workers continue to work in the community, pushing out information on the programs in conjunction with Community Health, our SANA, which is a partnering organization that we do work on SUD with, continue to do outreach on various health topics, and are continually produce the podcast with Lisa in multiple languages. And most recently, again, with the extreme weather event, went out with our community health workers from our community health department to outreach to members of the community to see if we could get people into shelter space as well. And then they went out afterwards to follow up on the situations at the motels for individuals as well. And we'll be working collaboratively with welfare on assessing status so we could find out what folks have planned for April and June when these programs that are supporting rental assistance ends. Our FEP coordinator worked with our Office of Emergency Management, participated in our volunteer coordination, and did a lot of work around preparation for the severe weather conditions and pushed out information for the response efforts. Public Health Network Strategist has been working to get our quarterly FAC meeting scheduled, and the agenda is set up with that. She's also completed a 1-year review of our goals and our objectives, continues to host our Public Health Matters with guests, and during the month of January had our National Transit, and our Office of Emergency Management at the meeting. The equity officer has made some great connections in the community and participates on several committees, including our National Soup Kitchen and Shelter with their grant planning, attended our Greater Nashua COC meeting, Elder Rap Committee, Cultural Connections, and also the SPINE, Social Determinants of Health Hunger Solutions. She continues to work on coordinating our framework for our culturally effective organizations and has a meeting pending with the department heads on leadership. Once that's wrapped up, then we'll have completed that assessment and we'll be able to determine some further forward movements. For staffing updates, we've had a wonderful time in January at the division. So we've hired for quite a few folks that people will talk about. And we also had the opportunity to hire 2 temporary positions with some student interns that are in the healthcare field, and they will begin working in February, and they'll work with us until June. It is a paid position. It gives them the opportunity to learn more about public health to prepare them for their future roles in the fields that they choose to work in. We have quite a few upcoming conferences that staff have begun to apply to attend, so hopefully we'll hear back on some of those once those occur. And then the other thing that I've just listed, a couple of highlights for us that I mentioned already about the meeting with the state, with several of our departments. Those things will continue on because we really want to see how much of an impact we can have on changes with regards to the housing situation. Bob and I had the opportunity to meet with the mayor to discuss this, and we will continue to meet with mayors across the state on addressing the housing issue in the state of New Hampshire, and in particular in our Nashua region. And I got a chance to attend Governor Sununu's inaugural celebration in January. I was totally unprepared for that. They had on gowns and they looked fabulous, and I thought it was going to be a business casual event, but I did put on my networking hat. So even though they shined in gowns, I made my rounds making sure I could talk with legislators about what the real deal is with the business that we need to take care of.
Excellent.
And then I also brought, just so that you could see, there was a question about SANA and what they're pushing out. And SANA is our syringe services access in Nashua. And so I brought the kit so that you could take a look at the naloxone kit that's distributed, some of the other things that are given, and then there's some handouts that have information about the services that are offered and instructions on how people can be safer if they decide that they want to continue to use, how they can be safer and to avoid overdose. Sorry about that, if you could, so we could take a look at that. Any questions?
Any questions?
All right, thank you.
Thank you.
Busy as always.
Wow.
Thank you. Next on the list, Kim.
Hi, yes, good afternoon.
I think that's you underneath the.
That is me. It's me. All right, so the first thing I just wanted just to touch upon was notes on the data. I did make a few updates to our data here as far as how we're reporting it out. And you can see, if you do have it in color, it was in light purple, I believe. So I'll just kind of go down. There's just a few things that I just wanted to mention. Under the COVID-19 lab reporting, we just added, actually the reportable disease categories at the top here, where we have the different types. That was previously it was at the bottom of the report, but it fits better up at the top. It's more appropriate up there. So we just moved it just so that you're aware of that. The COVID-19 lab reported cases, we just added the lab reported cases as Lindsay had mentioned. We just wanted to make sure that it was clear that this is not collectively the number that of cases that is in the that is reported out. It's more just what is reported by the state lab. So people could have done their home tests, but it's not reflected in here. And I just wanted just to point that out on there and make it clear. And then all outreach. So under sexual wellness clinic, let's see, under HIV, HCV prevention outreach, there used to be 2 lines here. We condensed it to one where it says Van and Street Outreach Contacts, and this is for all outreach and services. So it includes everything that we do for programming, and we've made it into one line just to streamline it. So we have the month of January, and then we took what was in the other line and did the cum for the fiscal year. Let's see, and then on the next page, under SANA, clarifying that this data here is the Revive data that we get from Revive, which is who actually runs the SANA program. We're subcontracted out to provide services, but this is the data that we're getting from them, so we're including that in here. Who we see during the days that we go is included under the previous line I mentioned, the Van and Street outreach. So that number is included in that line there, just for clarification. And we just added Mpox to the smallpox vaccine vaccine line, as they changed that name. And I think that was everything that was there. Any questions on that piece? Yes. Oh, I'm sorry.
I yield.
I want to know if you were in collaboration with Harbor Homes and Harbor Care. Yesterday this came up, I'm on that board as well. And it was high-risk targeted clients, and I had your information in front of me, and I had their information in front of me, and I was like, they want money to provide these services that you seem to provide. Are you in collaboration with them? Because it doesn't seem to make sense to me. They have like 189, I would say, HIV cases, and you guys had 77. So I don't understand the collaboration between Harbor Homes, Harbor Care, and what they're saying and what they're giving to us to get more money out of us. Is it the same? If they're providing you guys are providing this service, why are we giving Harbor Homes or Harbor Care the money? Is it a collaboration?
I can answer that. So
Sure.
we provide the service, we don't fund the supplies. So the supplies are funded through Revive, which I believe is part of, are they part of Harbor Care?
Not anymore.
Not anymore, okay.
Right.
So Harbor Care used to run the program. Revive now runs the program. And they subcontract with us just for services. So we provide people. We provide people that go out, they do the education, they supply, we give the supplies that Revive gives us, and that's how we collaborate with them. And as far as the HIV numbers, that's HIV tests. That's not our number of HIV cases. So that's our HIV number of tests performed.
Okay.
Our results are down here. We have not had any positive HIV tests this fiscal year.
I just used that, the whole number sync is the
Okay.
whole category. I just picked that one out, but
Okay.
it still doesn't make sense, and I still need clarification, so I'll take this offline.
Okay.
We might
I don't
have
know if there was
more here.
something else. that
Yeah,
Bobby
so,
wanted to
so
mention.
the difference between what we provide on the prevention end is like the outreach and the support for counseling and testing for prevention of HIV, hepatitis C, and they actually provide direct services to individuals that are living with HIV and AIDS. So we do collaborate in that if there's a positive case, we're gonna refer them to the agency that actually provides the care services, which we don't do. So that might be a little bit of the difference. And then the collaboration, their outreach workers, our outreach workers, if they do a combined outreach effort, we'll do that together as well. We don't duplicate services in that they have very distinct things that they're paying for funding for, and we're getting paid to provide the outreach, the testing, and to work collaboratively with them to get this stuff out in the community if they actually then work with Revive and our group to go out and do a larger outreach effort to push information out. So we don't have any duplication of services with Harbor Care. Does that make more sense?
Yeah, but now I got a million other questions, but it's not, it has absolutely nothing to do with the health department, because now you're telling me something different that Harbor Care is telling me. So I'll
Okay.
take that up a little later, because I was like, okay,
Yes.
thank you.
I like the way the graph and the way it redid it. The only question I have on page 2 on the Revive data, are we changing things? Because basically, the first column is identical to the third column. One is for January 2023, and the other one is for fiscal year 2023. Those are two different dates. So they can't really have the same number, or am I reading that incorrectly? Starting with.
Are you looking at under Revive?
Yep. I know you say you get that information from them, so it's not.
Oh, correct.
You don't own it, but what I'm saying is, how does January 2023 numbers identical to the cumulative 2023 or the fiscal year starting
So
July?
and I apologize because I added cumulative to
Okay.
this line.
Okay.
So just for this data, this is cumulative calendar year,
Okay,
as opposed to the rest of the
Fiscal.
data, which is cumulative
fiscal year.
year.
Okay,
Yes.
then that would make sense. Thank you.
You're welcome. It's just, that's how Revive reports out, so we just want to mirror what they're reporting out.
No problem, I just want to understand.
Nope, that's a great question.
Thank you so very much. Any other questions, Stephanie?
I have, I
You
just
have a
have some
question?
other,
Okay.
yeah, I have questions for myself. Happens all the time. I have other highlights to add, if that's okay.
Sorry.
That's okay. So some high-level programming, just to let everyone aware that we have planned our 5th annual Valentine's Day testing event, which will be on Valentine's Day, next Tuesday. And we're going to be serving clients at 2 locations, 9 to 11 at our clinic at Mulberry Street, and then 1 to 3 at the Soup Kitchen in Nashua. So there's no appointment needed. We are offering incentives while supplies last. They're gift cards. And folks can come down and get all their STD, HIV, and Hep C testing, and counseling and other services as needed. We can hook them up with services. So that is coming up. A press release was going out. A constant contact was going out to partners. And the other thing is, it kind of goes hand in hand, we finalized our contracts surrounding our HIV PrEP program. We did have a soft rollout last week that went very well. We were able to serve a few clients. And we'll be soft rolling that out over the next month to work out some of the just logistical kinks. And we do already have a waiting list. So we are taking referrals from other areas as well and pushing that information out. And we'll be sending out a press release as well. Immunization, the HL7 integration between our EMR and our NHIAS registry, the process continues with that. I have contacted the state for a timeline for approval. It has been quite a lengthy process. I was on the immunization call this morning, and they are trying to increase their staffing at the state and streamline that process. So I'm hoping that it's within the next month or so that we do have that HL7 integration. So what that does mean is that we won't have to double document, because currently we have to double document in our EMR and then put everything into the registry as well. So it is quite time consuming. So I will update you when we do get approval. And we also did hold our Q2 meeting between ourselves and the DHHS for our grant meeting that we do every quarter. That went fine. Outreach-wise, we did have 4 staff that participated in the point of time count to assess the numbers of those experiencing homelessness. Staffing and students update. We did fill the community health worker position. We had an internal transfer, so that worked out very well because it's someone that has been helping out with different activities in community health. Our previous community health worker, I believe I mentioned last time, now moved into a medical assisted position, a licensed support position within our department, and that's going very well as well. We also have had multiple students from most of the local colleges begin spring clinical experiences with us, either one-day shadow experiences or precepting experiences with our nurses. Some other highlights, there was a coaching session that was held at Sojourn Partners during strategic leadership meeting. We had staff that met with Altrix primary care practice to discuss their membership model for those that don't have insurance. I'm not sure if you're familiar with them, but they have a membership type model. It's a nurse practitioner run group, and it's quite interesting, but it is a good, it seems like a good alternative for folks possibly that can afford, a membership, but maybe maybe don't have that access to private insurance. And several staff attended the Mayor's Task Force on Substance Misuse Legislative Breakfast, where the focus, as Bobby mentioned, was on workforce development. And then the other thing that I just did want to talk about was gonorrhea. And I believe Bobby sent out the HAN, all of you? Okay. And I just wanted to touch base with a few things. Just that gonorrhea is on the rise nationwide. As you know, we're seeing a rise in New Hampshire and locally as well. Our clinic's seen an increase in cases. To give you some data, over the past 6 months, we've had a total of 9 cases, where we saw 9 cases in total last fiscal year. So we are seeing an uptick. All of our specimens are processed through the state lab, and the state will be conducting antimicrobial surveillance to detect circulation of resistant strains. So that's something new that they're going to be doing. The HAN was sent out, alerting of all the increasing cases and potential for the antimicrobial resistance and testing guidance. That was all sent out. And the state is also asking for culture isolates from a clinical lab to be sent to the public health lab for further testing. Some of the, and I can send you this data here, but I do have some data from FY20 up until FY23, where in FY20 we had 8 positive, FY21 2, FY22 9, and then so far, like I stated, it was 9 in FY23. So I'll send you this data, and it just breaks down risk factors and positivity rate, number of individuals tested.
Thank you.
You're welcome.
Any questions for Kim? Yes, Chuck?
Kim, thank you.
Yes.
Thank you for all your hard work. Altrex, does that include kids? Are you
I'm
saying
sorry?
The Altrex primary care, is that a family, you said there's
Yes, I
practitioners?
believe it is, yes.
So that's an option for families that don't have a PCP, that go get shots, is that what you're saying, or do well visits?
They have all kinds, I believe, I wasn't at this meeting unfortunately, but I believe that they have all kinds of services, like regular routine services, and they have lab, and they also have like x-ray and so forth. It wouldn't be for emergency services.
Okay, right.
So if someone, say, had like a catastrophic type insurance, it might be a good option for them. We can do vaccines we are always available to do vaccines
Right.
at the public health department. So we met with them because we were thinking about our TB population, our B1 population, how we could partner with them, with some of those clients, as well as, partnering with them for them to refer anyone that might need a vaccine, to us, especially kids, so.
I'm just nervous about the medical home for kids, if this is just a venue that just, ad hoc does things, it really doesn't centralize care for those kids, and if they're just getting this and this, they may fall through the cracks, or you sense it.
I don't believe that's how it works. I believe it's more of like primary care, but I can send you the information that they sent me.
Because I don't think, that's the first I'm hearing it, I'd like to pass it on to our,
Sure,
So
yeah,
our pediatric
absolutely,
person.
I can send it along.
and the second but different question was,
Sure.
with the ending of the free emergency kits, emergency home testing kits for COVID, supposedly, right, this April or something's happening. I raised the administration to Dartmouth today is, what can we do to help the people that don't have access to those kits? And the pharmacies now that have to, because I wrote a script the other day, it started yesterday, a family called in, they had 8 test kits that they could order through CVS. And I said, I've never heard that. So I asked the nurse to follow it up. Sure enough, the insurance said yes, CVS said yes, and I wrote the script. So I said, I just was thinking down the line, 2 months from now, is this a model that we as providers are going to need to do, because the kits are no longer going to be free or available through the mail. So they're not going to be able to, a lot of families can't afford that. So I threw out to John Thing and other people is, how can we at Dartmouth, be an entity to support the underprivileged, so that we didn't have either through a hotline or something that would help them get access to these kits that they could do. Because we're not now routinely testing in the office. We just say it's too short-staffed, we don't have ability, we have to shut the room down for 24 hours, and we don't have enough room to do this. So now they're being sent out to immediate care and urgent cares, and they have waiting times of 2 to 6 hours. So families aren't getting tested, so now they don't have the home kit to back that up. It just interferes with our care a little bit. So am I making sense?
You are?
Yeah.
You're making perfect sense. So we do have a large supply currently of the home tests. so you can refer to us.
Oh, okay.
I'm not sure how long that program is going on now. The state did send out a link, but I'm not sure when that is ending.
Well, that's what I thought. It was April. I mean, that's what he'd heard,
Is that
April,
what it
May
was?
was
I'm not
supposed to
sure.
be.
But there's,
ending.
but we have so
We
many
have
kids
so
that
many
we,
kids,
that
yeah.
the state is trying to move them. What do we get, like,
Feel
is it
like
like 1,500?
15,000 or
Yeah,
100
yeah,
or
we get,
something.
but we can get that, like 1,500, we can go back and get 1,500 and
Oh,
go
I see,
back. So
okay.
they just have a huge amount that they do want moved, and so, we can get them
Okay.
out as quickly as we can into as many homes as we can. I don't know what they're doing past that date as
Right.
far as, right?
Yes.
I just know we have a lot of resources now that we need to move out.
So I could share that we could call the public if families
Sure.
couldn't afford it. I've had a few that said, "I can't go buy
We
the
have
$20
them, we
kit."
have them available for free
Okay.
at our facility, so people can just come in
Oh,
and
thank you.
get them.
That'd be helpful.
Yep,
Thanks so much.
and we can give them some. But it is a very good point, and I think it's something that we need to ask the state about as to what is the plan moving forward. So I'll follow up on that.
Oh, thank you, thank you.
You're welcome.
It's funny that, talking about kits, I just picked up kits this morning, and they were free. You get 4 a month, and that's through Medicaid, and also your private insurance. So, and I just picked them up from Walgreens this morning. I didn't pay a dime for them. It's the Binex.
Mhm.
Right. Any other questions or comments? Yes, Stephanie?
Two things. One is relative to these test kits. My understanding is that when the COVID emergency declaration is formally ended, that's when the free kits will end and when insurers will no longer pay for them.
That's true.
However, it's sort of broken a barrier, because if we can test for COVID, we can test for flu and RSV. And so I think there'll be a sea change about the availability of self-test kits. If people could test for that, there's no reason why they can't test for other things. And it was really an artificial barrier, but I think that the prices will come down when they become more regularly used. If you're finished with your report, the only thing that stood out to me, and we've talked about this before, has to do with the lead testing.
Mhm.
And I noticed that in the minutes, it said that there was a 25% drop in lead testing since 2019, various reasons, understandable. COVID and the recall of the test kits. So do we have a plan? Is it something that you could talk about at the next meeting? As it gets warmer and the kids are, outside and,
Mhm.
the temperature changes cause paint chips to fall.
Yes, so I can speak to that. So the data here that states that it was a 25% drop in lead testing since 2019, that is statewide. So we're back to where we were in 2017. So we had a nice uptick, and we were coming up from 2017, and then we hit the pandemic, and now we're back to where we were.
Nice.
So obviously, the pandemic was, an issue, and people didn't go to the doctor, and they didn't go, we all know that, and we didn't get lead tested. So we are working on trying to, and the data that did come out also was suggestive of children that are on Medicaid being in that most of that 25%. So we are working on pushing out a plan to try to focus on that population specifically, where we definitely are testing and pushing out, doing a better job of pushing out testing at our immunization clinics for any child under 6. So that's something that we're working on internally. We did just hire a new lead coordinator. We have been in between coordinators with some staffing issues, so she'll be able to focus on this. And she actually came from the state and worked in the state program for years. So we understand that it is a huge issue, and we are working towards trying to get more kids tested and get the education out.
Thank you.
Thank you.
Further discussion?
Well done, thanks.
Nope. Thank you very much, Kim.
You're welcome.
Ivy, tell us about the environment.
Well, I can tell you about part of the environment. Heidi P. Kokoka, Nashua's health officer, with January's report for the Environmental Health Department. We added a couple of lines in our food service table here. One is voluntary closures, and the other is tickets issued. And so we will be tracking that. And we see that the failure rate dropped, which is wonderful for January, but don't know how that was achieved, but we'll take it. I'll jump into what we have done since the weekend with the cold weather and the freezing pipes. We had 2 of our staff pretty much both Saturday and Sunday going to different facilities with burst pipes, water coming out of ceilings and sprinkler heads and all of that. One I was really concerned about was a long-term care facility, and they were concerned that they weren't going to be able to get a plumber in as soon as they needed to, and they had to shut down water to an entire building. So there was no toilet flushing, no hand washing, and certainly no food preparation. But they were able to rectify the situation very quickly, but it could have been much, much worse. We have a couple of facilities that remain closed due to getting plumbing back online and different things that need to be corrected physically within their facilities. We suspended 1 license. The others were voluntary closures. But both Mike McGinnis and April Torhan did a tremendous job in going out and educating facility owners and management what they needed to do, what surfaces they needed to clean, what the priorities were, and it was a really messy, wet day, but they both really enjoyed themselves because they felt that they were making a difference. I would like to say, too, that as far as the division's overall activities for the freezing weather, I think that we collaborated very well, and I think that most people in the division were involved in one way or another in trying to make sure that we had options for people who are living outside, and to get that message out to the street, offer them an emergency blanket or a hand warmer and a list of resources that welfare had put together. So I think that we have something very unique here in Nashua, and I'm very proud to work here and work in such a collaborative atmosphere. And it may have saved lives.
I'm sure it did.
It's also something I feel fairly passionate about, so if you haven't noticed. Let's see, what else? We had another dog attack at a facility. It wasn't as bad as one of the previous ones, but we're starting to kind of anecdotally watch it a little bit. The dog was euthanized. It was not up to date on its shots. Somebody did have to receive medical attention. All the reports and the paperwork was followed through, and he was tested. But we've become such a dog-friendly society that these big, powerful dogs really need to have adequate training. And we can't require that, but there are people who are going to be hurt if we just keep treating dogs as members of the family without training. Let's see, and I thought about our discussion last month on acronyms. Ren and I spent 4 days with the Federal Food and Drug Administration for a workshop on, and the acronyms throughout that training were just nonstop. So I sympathize. So this was for the FDA Self-Assessment and Verification Audit Workshop that they call SAVA, for the National Food Retail Standards Program. And this was done in such a level of government ease that it was really good. It was well done, but it was a lot of dotted I's and crossed T's. But we're learning, because this is where we're going with. We're trying to become standardized to make sure that our food service program is as bulletproof as possible, and that we are doing things the same way across the country. And a lot of this has derived from NEHA, National Environmental Health Associations, partnering with FDA in order to get this message and some consistency across the country. So it's going to be a lot of work. We're excited about it, but I could not take another minute of this number of the code requires this, and the calculation is this, and then that. It just was too many numbers. Let's see, what else is here? We stay busy with different activities, trainings, and we also attended the coaching session with Sojourn, and our inspectors are doing a boot camp training. Let's see, and Ren and I stay busy with NASHWA, New Hampshire Health Association, New Hampshire Health Officers Association, sorry, and we had our quarterly self-inspecting meeting with the state and local jurisdictions. And I'm just gonna skim through a lot of this. And we've been very busy and working collaboratively as well on encampment meetings and trying to discuss some basic safety sanitation issues with the encampments, and trying to kind of make a better safety net for people who are experiencing homelessness. And as Bobby had mentioned, we have been working to try to better the situation for our more vulnerable elderly population, especially those who are just suddenly discharged from hospitals or something like that, and don't have a stable place to go that will serve their needs well. And thank you for putting the legislation in. There are 3 bills that we're watching closely, so we've culled them down from that list. And the one that we are most opposed to is House Bill 122, the Micro Enterprise Home Kitchen, which turns home kitchens into a legal definition of a food service establishment, and then it takes away all of the safety precautions. So we're very concerned about that. And then another one affects the towns more than it does the cities, but that's House Bill 154, which is the adoption of public health ordinances, and that is direct response to the mask mandates. And then we are in support of House Bill 534, which is water assistance during natural disasters, which sounds like a really good idea, and I'm very glad that that has some NASHWA influence on it. And that's all I have.
Thank you very much. Any questions?
Excellent.
Comments? Yes, sir.
YTIA. Your team is amazing. Just want to get on the mnemonic words.
I did not know where you were going with that.
I'm going to add to your wonderful.
Oh,
Been
thank
working on
you.
that for a month.
We like that one.
It was. Finally had a chance to use it. Thank you.
It's our team, yes.
Any other cool questions like that? All right. Thank you very much.
Thank you.
Roberto, you're up, buddy. Good afternoon.
Bob Mack, Welfare Officer for the City of Nashua, reporting out on the Welfare Department report for the month of January. You can see, again, our pattern of increased expenses in the shelter line item. That's where we're seeing the most of our expenses. I mean, one of the things that, we've talked a lot about the homeless population and services and outreach efforts and engagement with that population. I just wanted to highlight that one of our focuses in the welfare department is actually keeping people housed whenever possible. So we spend a lot of time trying to do that, negotiate with landlords and cover rental costs. Or it could also be through covering other costs such as utility bill costs so that they can pay their rental costs as a tenant. So either through that direct assistance or also referrals to other community partners. We're trying to prevent homelessness whenever possible. That being said, we still have a great deal of work to do with the homeless issue. So we'll continue in those efforts. Let's see. Staff did participate in many meetings throughout the month. We continue to engage with our community partners, including the shelter programs. Part of the increase in resources included the soup kitchen, as I might have mentioned this last month as well, moving over to Spring Street and expanding some of their shelter beds, and they have been operating their winter overflow program as well. I believe they're seeing around 20 or so additional shelter guests per night in that program. That being said, there were still some individuals in encampments that did not want to take advantage of those resources for whatever reason. So again, a lot of the outreach efforts involved safety planning and different alternatives for warming, what have you. The annual point in time count was completed. I believe Kim mentioned community health workers and community health staff. I know community health workers participated in that, as did welfare staff and general outreach staff in the community. So working together to try to engage these folks for a count, which is kind of in addition to what they do on a regular basis, to try to engage them, to get them connected to resources. This is a required count from HUD, so it's very important that this is done every year, and we did coordinate that with the state of New Hampshire. So that's the count that takes place across the state. So that will probably take a little bit of time for them to compile and deduplicate and do what they do with the data. So when we get some information on that, I'll report that out to this group as well. Let's see, it was mentioned by Director Bagley, we had some staffing in January. We did hire a new welfare specialist, Adelina Hernandez. And she's fitting in nicely with the department and the division. And she brings a good skill set with her to the division and the department. Not only from her previous work at the school department, but she is bilingual, bicultural as well, which is something we needed in the welfare department. We are following up closely with Southern New Hampshire Services as the emergency rental assistance program is winding down over the next few months. Sandra DeLosa, the welfare specialist supervisor, and myself will be meeting with Donnelly Lozo and some of her case management staff next week to kind of go over some case management planning for some of those households. And as Director Bagley mentioned, the community health workers have been trying to do some outreach around the motels as well to make sure that we get these resources out to them and that they understand what resources they have and also understand what some of the limitations are with some of the resources we have to offer, which are different in some ways than what they've been receiving through this emergency rental assistance program. So we'll continue to follow through with that. One of the conversations, one of the meetings that we participate in, division staff participate in, is the healthcare coordination subcommittee. And a lot of conversation that involves the hospitals, some health care for the homeless providers, some home care providers, et cetera, the shelters. A lot of the conversation at the last meeting revolved around respite and respite care, because as it was mentioned, there's a population of elderly and medically compromised homeless that are showing up at hospitals, and they're trying to plan discharging, and there's no real good place for them to go. So this is a big issue that Director Bagley has taken up to the state level, and I think there's more work to be done on that, and it's good that I mean, it's good the issue is coming to light so that it can be addressed accordingly. And I think it's gonna take funding and resources and a place to go and development of a consistent plan to deal with this special population. And we'll continue to try to coordinate efforts for those that may be able to sustain in motels with some additional service, or also in shelter programs, if there are some additional services there. But I think there are different levels and such that need to be met for these different programs. Let's see. I think I covered that, so. Right now, we've expended about 59% of our budget for the year, so it appears a little different than previous years. We're on target to spend our entire budget for general assistance this year. We're monitoring that closely. We're hoping with the income tax season coming that some households will have some additional resources and may not need to come to see us. We'll help them and educate them, guide them as to how they should utilize those funds, even though they're just one-time funds. Some of them are pretty significant and could cover a couple months' worth of living expenses. So as they come in to see us, we'll try to guide them to use those resources accordingly. So with that being said, don't have anything else unless there are any questions.
Any questions?
I have one question.
Yes, ma'am.
You said guide them to use their resources. Once that money come in, first we probably have to guide them before the money come in, because once the money come in, that's done.
Right.
So,
Right.
how you plan to combat that issue? Because I found that people are not accustomed to a large amount of money.
Yeah.
They spend that right away. So they're happy one minute, the next minute's
Yeah.
gone.
Yeah.
So how would you address that?
It's a very good point. Well, one of the things we try to do is guide the people that are applying now
Mhm.
for when they do get that refund. This
Mhm.
is what we're kind of expecting you to do.
Mhm.
So hopefully we catch that before it's
Yeah,
happened.
yeah.
We also guide people to resources like volunteer income tax assistance programs, the VITA programs. It's free tax preparation assistance. It can actually save a lot of people money, hundreds of dollars that may go to other tax prep places, and they say, well, I can get an advance on my refund if I go here, but you're also paying $500. So that's $500 less that you can get, and it's not that big of a difference if you're waiting another few weeks to get that refund. I think it's probably worth keeping $500 in your pocket, so to speak. So we try to educate them ahead of time, but just pushing out the information about the VITA sites. They also try to guide people as to what they should do with some of this money. Maybe in not as much detail as we might do, but so it's a challenge. If they've already gotten their refund and have spent that, that's kind of another story. So, but hopefully they've made some good choices. But people do, some people do use that money to maybe buy a car that they need to get to and from work, or they do cover, many of them do cover back expenses or back utility bills. So I hope that answered.
It does. Thank you.
So.
Thank you, Bob. Any other questions? Seeing none. The only thing I have is, last month, we talked about, and I promised a contact person for the high school. I'm not sure if you're handling
Yes,
it,
thank
Kim?
you.
I'll just pass that down. Thank you for doing that again.
Absolutely.
We really enjoyed it, and
We enjoyed it too.
and I guess we have a real big shortage of LNAs. So
Perfect.
we're hoping to
Yes.
stimulate some more high school students to go into nursing. Is the idea.
Yes,
Really.
please.
Okay,
very honest
I'm just gonna move on to public comments, and seeing no public here, close that section, and I'm looking for a motion to adjourn.
Motion to adjourn.
All right, everybody wants to get out of here. Those in favor?
Yes.
One last thing, vacation schedule for the summer, just think about it, we'll talk about it next month, but usually we do July or August, is that month off, so just let you know. And last, happy Valentine's Day.
And happy Black History Month.
That's true, too. Yep, very good. Any which way, stay warm.